Distinguished participants, ladies and gentlemen, let me start by thanking the moderator, Ms. Nicole Foster, the organizers, Trevor Hassel and the Healthy Caribbean Coalition, as well as our host, of course, the government of Jamaica. This meeting is important in the build-up for the high-level meeting in New York, and I'm very grateful for the invitation to come and explain how the United Nations agencies, funds, and programs that support national development efforts have come together to help the Caribbean region push back against the NCDs. As the resident coordinator of the United Nations for Jamaica, the fight against NCDs is clearly one of those issues that justify the need for someone like me. Very reassuring, isn't it? For one thing, the population of United Nations agencies that are involved in fighting NCDs is surprisingly wide and diverse. But then in addition to the usual suspects at WHO PAHO, it includes the Food and Agricultural Organization, the International Labour Organization, the UN Development Programme, the United Nations Organization for Education, Science and Culture, UNESCO, UN Women, UNFPA, the Population Fund, and UNICEF, but also some discrete, almost nocturnal animals like IAEA, and certainly others. So this coordination challenge is not unique to the non-communicable diseases. The United Nations have extremely varied assets, all of which have long worked in the Caribbean. But the challenges of upper middle income countries are different. And so is the context of the post-2015 development agenda. To keep answering the needs of our member states at a time of growing complexity and shrinking resources, we needed a new way of working. So accordingly, instead of agency by agency and country by country programs, 20 plus United Nations agencies and 18 English and Dutch speaking countries and territories in the Caribbean have agreed on one single umbrella framework for the period 2017-2021. 13 of these countries are CARICOM members, and discussions are ongoing for the government of the Bahamas to join the framework. This framework is called the United Nations Multi-Country Sustainable Development Framework, or UNMSDF. At the regional level, the latest CARICOM United Nations biennial meeting agreed on the UNMSDF as the framework for collaboration between CARICOM and the UN in the region. So how did we arrive at the UNMSDF? First, we looked at the needs. A common multi-country assessment analyzed the priority challenges faced by our participating countries. And some of the general findings will sound familiar after already nearly 2 days of presentations. The interest of Caribbean countries in region-wide cooperation as a tool, further integration, the need for closer cooperation with regional organizations such as CARICOM, and the imperative of deepening partnerships with civil society and the private sector. Now, among the sector-specific findings, a number reflected NCDs as a priority for the region, starting with the realization that the Caribbean is the worst affected part of the Americas, with 70% of deaths attributable to NCDs. As a result, the prevalence of NCDs was widely portrayed as the primary health challenge, particularly diabetes, strokes, hypertension and heart disease, cancer, and chronic respiratory ailments. Major impact of the NCDs were identified in households and individuals, of course, but also on health systems, on state budgets, and on national economies. So when the results of the needs assessments were presented to them, the countries of the region agreed that non-communicable diseases constituted a priority cross-cutting development challenge for the 5-year period, and not only a health concern. So what difference do we aim to make through the UN Multi-Country Sustainable Development Framework for the Caribbean? Building on the findings of the Common Country Assessment and the priorities expressed by our member states, the UNMSDF has identified 4 main areas for our joint work, and one of them is a healthy Caribbean. Within this priority area, one of 2 outcomes for the UN system is laws, policies, and systems introduced to support healthy lifestyles among all segments of the population. And it is within this area that the United Nations agencies seek to support our member states' efforts at tackling non-communicable diseases. The outcome focuses on the need to examine and strengthen systems to address mounting concerns about the impact of NCDs on the lives of Caribbean women, men, and children, such as diabetes and hypertension, risk factors such as tobacco use, and the strain these place on health systems and economies. And accordingly, in 2017, 7 United Nations agencies were working on initiatives specifically tackling NCDs, from Barbados and the OECS to Belize, Guyana, Jamaica, Suriname, and Trinidad and Tobago. Other than PAHO WHO, these agencies included FAO, ILO, UNDP, UNESCO, UNFPA, UNICEF, and yes, IAEA. Ongoing projects tackle a range of issues around NCDs, including intersectoral policies and programs for food and nutrition security, promoting inclusive food systems for healthy eating habits, school feeding policies, education campaigns on nutrition, prevention of substance abuse, management of cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases, national strategic plans on NCDs and tobacco control. In addition, within the regional collaborative effort fostered by the UNMSDF, a virtual policy network of UN colleagues from multiple UN agencies located across the Caribbean will focus on non-communicable diseases, specifically in line with CARICOM priorities, child obesity. This year, they aim to support member countries in the run-up to the 3rd UN high-level meeting on NCDs. Multi-agency advocacy material is under preparation, and support will be extended to interested member states. The United Nations agencies have committed through the UNMSDF for the Caribbean to address NCDs as a region-wide development priority. So what do we need to do together to help make the UNMSDF a success? Again, other speakers have made the very same points. We need innovation and effective partnership and advocacy to mobilize new additional resources. We need all parties to make good on their stated commitment towards integrated action around these intersectoral issues. And we need continued support and tighter partnership with governments and civil society organizations. Oh, and since, like me, you're probably a little surprised as to what IAEA, the International Atomic Energy Agency, might have to do with NCDs. Well, just so you know, they've just launched in Jamaica 2 new projects, one to improve cancer diagnostic and treatment, but also one on the disease resistance of ginger and sweet yam. And then one final point. Charity begins at home. On NCD issues, as on many other issues, all of us must walk, or in this instance, run or dance the talk. All of us, government bodies, civil society organizations, private sector companies, or international agencies, must practice what we preach and help ourselves by helping our staff change behaviors to improve their own health and that of their family. So let me mention just 2 initiatives of the United Nations in Jamaica. Jamaica's Minister of Health, the Honorable Christopher Tufton, who spoke here yesterday, has taken the lead in a very physical sense of a Jamaica Moves campaign. Well, Honorable Minister, what took you so long? For some years now, right outside my office, the UN staff 2 evenings a week run a karate class and 2 evenings a week a Zumba class. If you have to ask, you probably need to take the class. And I won't mention the vaunted benefits of all those lime evenings my staff are so fond of, Rachel. Second initiative, a long-running global program helping UN colleagues tackle HIV/AIDS, now facilitates in Jamaica an annual staff wellness day, where colleagues and their children can, in a festive, supportive environment, consult health practitioners, get their body mass index estimated, have their blood sugar level and blood pressure taken, know their HIV status, meet stress counselors, meet exercise coaches and try out some of their classes, access HIV counseling, and have a Jamaican good time. So to wrap up, the United Nations agencies and the governments of the English and Dutch-speaking Caribbean have identified NCDs as a priority area of work under our joint coordinated program of cooperation 2017-2021. Through this more focused, integrated approach, at a time of increased complexity and limited resources, the United Nations agencies aim to achieve better results through more efficient cooperation on this intersectoral development issue. We look forward to continuing to work with all interested actors in the region and beyond to make a difference in the lives of the people of the Caribbean. Thank you very much.
So thank you, Mr. Pouezat.